Hey, it's Buck Joffrey here again with Dr. John Bridger, who is with Santa Barbara Podiatry.com. He is the foot doctor in town, certainly the guy I trust my feet to. So welcome back, John.
Thanks.
Yeah, so today I wanted to just kind of give a little bit of information on a problem that you hear a lot about. People all of a sudden start having pain in the arch, the inside of their arch of their foot, right? So
Yeah.
that's common, right?
It's really common.
Yes.
Your arch is such an important structure. It helps support your entire foot. And as time goes on, especially with increased activity, you can see that arch begin to collapse. And that causes kind of chaos for the muscles in the foot, and it can become really painful.
Yeah, so what exactly is going on? Maybe we could look at a foot or something like that.
Definitely. Let's take a look at the model. So here's a model of a left foot, and this is the inside of the foot. Patients with this problem typically complain of pain in the arch here on the inside of the foot, and oftentimes it's kind of an insidious onset, so there's not a particular injury that's noted. And as this arch begins to lose some of its support, what most commonly happens is you get pain in the tendon. And so to go over a little bit of the anatomy here, you have a tendon that runs down your ankle and comes and attaches right here in your arch.
And what does that normally do?
So that tendon actually is helping to support your arch, both when you're standing and when you're walking.
Okay, so it sort of keeps it up and gives it that curve, right?
Exactly.
It's almost like a sling.
Exactly, yes. It's very much like a sling that's helping to hold up your arch. And so if this tendon gets weakened, which can happen by either a lack of support, not supportive enough shoes, or just extended activity, then that tendon will begin to deteriorate, and that can be extremely painful. And while you can treat it sometimes by just staying off of it for an extended period of time, that's rarely an ideal solution. So if you can get it well supported, which I do with tape and padding, then you can allow it to heal while you continue on with your daily activity.
So why do we have that sling in the first place? And what happens if you're flat-footed? You just don't have that, or what?
So everyone has this tendon, but yeah, it supports your arch, and some people do have more of a flat arch, and that puts a little bit more pressure on that tendon, and so they're going to be a lot more likely to have problems.
Oh, okay, got it. So when you're kind of losing the support, what is it that's causing pain? Is it the tendon itself, or is it because the bones are flattening out?
So if you think of this tendon as helping to support your arch, as the arch begins to collapse, it's working harder and harder to try to support the arch there. And when it gives out because it's been working so hard, that's when it gets painful.
Okay, got it. So if you don't treat this, first of all, does it just keep going and does it take care of itself? Or
sadly, a lot of people self-treat it by just really diminishing their activity a lot. And it's just unnecessary, because if we can support the foot and support that tendon, then you can heal without decreasing your activity. So unfortunately, self-treatment really, it works if you're off your foot, but what kind of treatment is that?
Right. And how bad can it get in the worst case scenario?
In the worst case scenario, it can get so bad that you have trouble even putting your foot down to walk. It can lead to really severe limping, and when it gets that bad, you oftentimes need to immobilize it like in a boot or a cast. But when it's more mild, you can treat it with taping and padding, which allows you to continue in your shoes.
Does there come to a point where you actually can't really fix it anymore? Because what do you do then? Is it surgical?
So exactly. So if you end up with what's called a rigid flat foot, which is where that tendon, no matter how hard it works, it can never bring that arch up because your bones have adapted to the new structure. At that point, you need to actually surgically correct the bones to give yourself an arch. And that's the most severe instance.
So hopefully it doesn't get there. In the short term, if you start noticing this, we come and see you, what would you typically do at that point? You wrap it up, and it might be several weeks of wrapping and that sort of thing?
Yeah, so more than just wrapping, I start by putting a pad into the arch that helps support it, and then taping will help immobilize the tendon, which will help it to heal, and you're always going to have some localized swelling around where the tendon is, and the tape will help minimize that. So step one is both to relieve your pain while trying not to limit your activity. And once we get you pain-free, then the next step is prevention.
Right.
And
Makes sense.
yeah, the key to prevention is custom orthotic.
Right.
Custom orthotics will support that arch long-term and hopefully prevent this from coming back.
So obviously this isn't something that you're going to want to self-treat like sometimes you can do with other things. So if we want to get a hold of you, how do we get a hold of you?
The best way to get a hold of me is on my website, santabarbarapodiatry.com. You can see the link below, and you can send us a message and we'll get you an appointment.
Thanks, John.